Hello, everyone. So today we're going to be talking about chapter 15, or at least the beginning of chapter 15. I'm going to break chapter 15 down into 3 lectures. So today we're going to talk about part of chapter 15, which is on differential reinforcement. And again, differential reinforcement is going to be one of the many procedures discussed to reduce problem behavior. Now, what is differential reinforcement? There are actually different types of differential reinforcement, but all of them involve using extinction combined with reinforcement. So what you're doing is you're putting the problem behavior under extinction. Now remember, in order to put problem behavior under extinction, you need to know exactly what is the reinforcer or the consequence maintaining the problem behavior. And how do you find out what the consequence for problem behavior is? You do it by conducting a functional assessment, which was the topic of the previous lectures, right? So you conduct a functional assessment, and then you come with a conclusion about the function of the behavior. And once you identify the function of the behavior, you identify whether behavior is maintained by social positive reinforcement, usually in the form of attention or tangible. If the behavior is maintained by social negative reinforcement, usually in the form of escape or avoidance of tasks, or if the behavior is maintained by automatic reinforcement, then once you identify one of those behaviors, then you can withhold that specific reinforcer once the problem behavior occurs. So problem behavior should no longer produce the reinforcer that has been identified as responsible for its maintenance or its occurrence. But at the same time, an alternative behavior that is the appropriate version of the problem behavior, right? So if there's a problem behavior, then what should the individual be doing instead? So if the individual is engaging in this problem behavior because in the past the problem behavior has produced attention, then can we teach an appropriate way for that individual to produce attention? And I think that's very important for us to think about, right? So oftentimes people say, oh, problem behavior, you've done a functional analysis and you found out that the problem behavior is maintained by attention. Okay, what does that mean? Well, most folks would say, well, it means that problem behavior occurs in order to get attention, right? That's kind of a weird way of interpreting things. I don't like it because it suggests that the individual is doing it on purpose, right? So it's like, well, the individual is doing it in order to get this future consequence that hasn't occurred yet. Well, imagine a little child with some developmental disabilities that has never learned how to appropriately communicate. It may be that, one day she fell and hurt herself, and then all those folks came and talked to her and asked her what she needed. Well, notice that maybe falling and maybe hurting herself has produced, or not maybe, it did produce the reaction by the adults. And maybe that happens again and again. And now you see that the behavior of injuring oneself produces attention. So in the future, if the child doesn't have any attention, if attention becomes a reinforcer, right? What would the child do? Well, the child will engage in behaviors that in the past have produced attention. So it's important that we think in terms of behavior occurs because in the past, behavior has produced that reinforcer. Therefore, it is likely that the behavior would occur again because of this previous history of reinforcement, not because the person wants to produce attention or wants to escape from a task, right? Behavior occurs because it has been reinforced in the past. So if the problem behavior is what has been reinforced in the past, so it is likely to occur at a situation, then what do? Well, you have to identify what the reinforcer that has been delivered in the presence of the problem behavior had been delivered in the presence of the problem behavior in the past, withhold that reinforcer, so not deliver that reinforcer, and now instead deliver that reinforcer in the presence of an appropriate behavior, of something that should be occurring in order to produce that reinforcement. So in the case of attention, maybe if self-injury is what has reliably produced attention, maybe now we can teach an alternative response. Maybe we can teach a form of communication so the child can ask for attention, or the child can initiate communication so people can talk to her, or the child can, whatever. But it would be an appropriate version, an adaptive version of a behavior that would normally produce attention, as opposed to this problem behavior, disruptive behavior that for some reason got shaped up in that individual's life. There are different types of differential reinforcement that we use as treatment. Today, I will talk about differential reinforcement of alternative behavior, also referred to as DRA, that's the acronym, DRA. We also have differential reinforcement of other behavior, and the acronym is DRO, and also differential reinforcement for low rates of responding, and the acronym here is DRL. There are subtypes of DRA, and I'll talk about those subtypes as well. And there are some different subtypes of DRO and DRL. So we'll talk about all those three in the next few lectures. So today I'm going to focus on the differential reinforcement of alternative behavior, or as I said, DRA. Now, what is DRA? Well, similar to what I just told you, DRA, excuse me, involves reinforcer being delivered for the desirable behavior and extinction for the problem behavior. There are some situations in which the problem behavior cannot be extinguished, and I'll tell you a little bit about it in a few minutes. And there may be some situations, rare, but the problem behavior may have to produce some form of aversive stimulus, or may have to produce some sort of punishment. We'll talk about that later when we discuss punishment. So when we talk about differential reinforcement of alternative behavior, we're really talking about a concurrent schedule of reinforcement. So we have two schedules of reinforcement in which two response classes receive reinforcement at different rates. So you have one class of responses, which are the appropriate behavior. So the appropriate behavior may not always look the same every time it occurs. So imagine if you're teaching someone to initiate conversation in order to get attention, as opposed to engage in disruptive behavior. Well, initiating conversation may not always look exactly the same, and that's why we refer to it as a class of behaviors, right? So this class of behaviors may produce reinforcement, and in the beginning of treatment, maybe every single time it occurs. So every single time the individual initiates conversation, you have to go there and reinforce, because if you don't, problem behavior may emerge. So of course, in the natural environment, when I initiate conversation with people, they don't always respond. They don't always want to talk to me. Sometimes they walk away, or they just respond very briefly. So we, of course, ultimately, if you're using DRA, you would want to teach the individual to sort of deal with this frustration, deal with the fact that your behavior may not be reinforced every single time. So you may have to thin the schedule, so the schedule is not a continuous reinforcement schedule, right? So eventually you have to thin the schedule, because that's what the schedule looks like in the natural environment. But remember, when we talked about schedules of reinforcement earlier in the semester, when we were meeting face-to-face, I told you initially, when you're teaching behavior, in the beginning of treatment, behavior has to be reinforced every single time it occurs. And it is the case here with differential reinforcement of alternative behavior, or with DRA. The reinforcer is delivered every time the desirable behavior occurs. So if you're dealing with behavior, disruptive behavior again, that in the past has been reinforced by attention, then let's teach an appropriate behavior, which we are going to call initiating attention. And that's a response class, different ways of doing it. But every time the appropriate behavior occurs, attention is delivered. And another class of behaviors are the problem behaviors that, again, may not always look exactly the same. And that class of behaviors have to be placed under extinction. That's why we say Concurrent schedules of reinforcement in which two response classes, the class of desired behaviors and the class of problem behaviors, receive reinforcement at different rates. The rate of reinforcement for desirable behavior should be a high rate of reinforcement, right? A dense schedule reinforcement like an FR1. And the reinforcement for problem behavior should be a very lean or extinction schedule, right? So it should be no reinforcement. In some cases, behavior may contact reinforcement depending on the nature of the behavior. You may not be able to place under extinction. And again, I'll give some examples later. Now let's talk about some examples of DRA in the natural environment. Now here's one before I even show the examples that I have on my PowerPoint. So sometimes when I'm having dinner with my wife and I want something on the table, I just point, or I may, sometimes make a sound like, and then usually my wife looks at me and says, use your words. So what is she doing? Well, she's prompting the appropriate behavior and putting the problem behavior under extinction. So the pointing and grunting is according to her, the inappropriate behavior, right? So it's the behavior that should not produce reinforcement. But if I, on the other hand, say, can you pass me the salt? Then she would then reinforce that behavior. In the same context, I may ask my wife, pass me the salt, in which case she would not do it unless I say, can you please pass me the salt? So notice that, saying please is the appropriate behavior that she is reinforcing by, of course, passing the salt versus the problem behavior that may have been reinforced because in the past when I was direct and I just told people what to do, people did things to me, so that behavior is reinforced. So I'm just very direct. So when I'm direct at home, because that behavior has been reinforced maybe at work or elsewhere, that behavior is placed under extinction, and then the appropriate behavior, which sometimes my wife has to prompt, right? She might be say like, can you do it again? Like, and I say, oh, can you please pass me the salt? That behavior produces the reinforcer. So we use DRA all the time. Like I said, DRA, a lot of the behavior procedures that we use are derived or taken from how behavior is reinforced in the natural environment. We just gather the information that we know about how behavior is maintained in the natural environment and then artificially create those procedures to deal with problem behavior in the clinical setting. So here are some, again, examples of DRA. So this is a similar example that I just gave you with my wife, right? A child's good table manners are reinforced with praise and by passing the requested food, but the bad table manners are extinguished by ignoring or not passing the food. Here's another one that doesn't involve even a person mediating the behavior. Now, punching the correct number, your password in the ATM is reinforced with cash, right? So if you punch the right number, you get money. But if you punch the wrong number, you get nothing. So eventually, punching the wrong number is extinguished. So if you think about many of the behaviors that you engage in may involve differential reinforcement in a sense that certain classes of behavior produce reinforcement, but other classes don't. I would suggest that you stop here, pause the video, and think about examples of differential reinforcement in the natural environment, such as the ones that I'm using here. You may also consider at the end of the lecture examples of even how to use differential reinforcement in your life, right? Are there certain behaviors in the individuals that even that you engage in or people that you interact with that could be replaced by more appropriate ones? And could you prompt those behaviors? And could you put the problem behaviors under extinction? Again, I'm not suggesting that you do any experiment with anyone without consent, but that's usually how we manage ourselves or manage the behavior of others, right? I mean, we expect appropriate behavior, and we would prefer to that the problem behavior or inappropriate behaviors do not occur, right? So if maybe you have a friend who gossips too much and that annoys the crap out of you, well, maybe one of the things you could do is you could pay more attention and react more enthusiastically when that person is not gossiping or engaging in more appropriate conversations. And when the person starts gossiping, you can, change the subject, walk away, tell them like, hey, I have to go walk my dogs. Which, by the way, is the best excuse, like at the university all the time. If I need to do something that I don't want to, I say, I'm going to go walk my dog. So notice that saying I need to go walk my dogs is the behavior that has been reinforced by negative reinforcement, escape, right? So escape and maintain behavior. They present me with a demand, and I'm like, oh, I'm sorry, I can't do it. I have to go walk my dogs. And we can talk about how they could place their behavior under extinction, right? Anyway, someone, I'm glad that people in the psychology department don't understand behavior analysis that much, because otherwise they would have already fixed all of my problem behaviors. Now, there's some variations of differential reinforcement of alternative behavior, and I'll talk to you a little bit about them. I'm going to give you a couple of examples. One of them is DRI. So a variation of DRA, or differential reinforcement alternative behavior. You can have a differential reinforcement of alternative behavior in the form of DRI. And in this case, it's the same thing that I just told you earlier. The difference here is that a DRA procedure will qualify as a DRI if the alternative behavior that you're teaching is incompatible with the problem behavior. If you cannot engage in both at the same time, right? So for example, if someone is knuckle cracking, and that's very annoying, maybe you can teach the person to, squeeze their hands, and put them like, by their legs every time they feel the urge to crack their knuckles. And if you notice, if you reinforce that behavior, the behavior of the hand squeezing, and you put the knuckle cracking under extinction, you notice that you can engage in both at the same time, right? So that's why it's a DRI, because the appropriate behavior is incompatible with the problem behavior. Now, FCT is, or functional communication training, is a type of DRI in which the appropriate behavior that you teach is a form of communication, right? So here, imagine that head banging, again, has produced attention in the past. Now, if you teach American Sign Language, if you teach the individual to use sign language to get people's attention or to call for someone, then that would be the appropriate behavior is a form of communication that has replaced the problem behavior. If the appropriate behavior is a form of communication, that the DRA procedure, or the differential reinforcement of alternative behavior, can be called functional communication training. If the alternative appropriate behavior is incompatible with the problem behavior, then we will call that DRA procedure a differential reinforcement of incompatible behavior, or DRI. Hopefully that makes sense. I may post in the discussion section some questions about examples of DRA and DRI. I actually have in front of me a really cool book that just came out, which is what we call the Applied Behavior Analysis Bible. This one is called Applied Behavior. You probably cannot see it, I don't know. Applied Behavior Analysis by Cooper, Heron, and Heward. It's a book on all it's like the book that you're using, 171, just way more complicated for folks who are studying to become board certified behavior analysts. And I flipped through the chapter on differential reinforcement, and there's a nice table here on examples of alternative behaviors for common classroom behavior problems, right? So I'm gonna read them to you. And this was adapted from another book, I think. Okay, so let's see the examples that they give here. The first example is talking back. Now, I'm sure that typical kids talk back to not only the teachers, but their parents, right? What could be some alternative behaviors? Positive response, such as yes, sir, or okay, or I understand, or acceptable questions, such as may I ask you a question about that? Or may I tell you my side of the story, right? So as opposed to of being defensive and talking back, you can teach kids to do that. Now, if you have a typically developing kid at home, maybe those are good examples of things that you can do, or some advice. Now, here's another one, cursing. Now, what would be an alternative behavior that could be reinforced? So cursing would be placed under extinction, and then you could prompt an acceptable behavior that would then produce reinforcement. So other exclamations such as darn could be one. Being off task. An appropriate behavior could be any on-task behavior such as looking at the book, writing, looking at teacher, etc. Being out of seat, that's another problem behavior. What could be a behavior that we can prompt and reinforce instead? Well, sitting in the seat, right? With the bottom on the chair, body in an upright position. Non-compliance, I'll give some examples here on compliance in a couple minutes, but non-compliance, the appropriate version or the alternative behavior could be following directions within X amount of seconds, right? Following directions by a second time as soon as the direction is given. Talking out, the alternative behavior could be raising hand and waiting quietly to be called on. Turning in messy papers. No marks other than answers. That could be the alternative behavior. Hitting, pinching, kicking, pushing, and so forth. Now, again, instead of doing that, you could teach the child to use verbal expressions of anger, pounding the fist into hand, sitting or standing next to other students without touching them, and so forth. Tardiness, the alternative appropriate behavior could be being seated when the bell rings, right? Which will be at the desired time, and inappropriate use of materials. Now, the appropriate behavior could be holding, using materials appropriately, for example, writing only on the appropriate paper, and etc. So those are all different things that you can think in terms of like, okay, I don't like this problem behavior that this kid is engaging in. Well, punishing it might not solve the problem because the behavior has a reason why the behavior is occurring, right? There's a function. So you should try to produce that or deliver that reinforcer, fulfill that function by prompting the kid to engage in an appropriate behavior instead. So, you know, you want attention, great, you can get attention, but you're not going to get attention by engaging in this inappropriate behavior. You're going to get attention by engaging in the appropriate behavior. And let me tell you what this appropriate behavior should look like. Now, when do we use DRA? Well, DRA, again, you would use when you want to increase a desirable behavior and you want to decrease an undesirable one. That's why we refer to as replacing it a problem with an appropriate version of the behavior. The desirable behavior has to occur at least occasionally so you can prompt it. Now, if the behavior doesn't occur, then you may want to teach it before you use DRA. So you may have to use shaping or prompting and fading like we talked about in the chapters on how to teach appropriate behavior. Now, you need a reinforcer that you can use. So oftentimes the reinforcer that you're going to use is the reinforcer that was identified in your functional analysis of the problem behavior. So you have the problem behavior, right? So if you look at the book the examples I just gave you, imagine the problem behavior is, I don't know, non-compliance, right? So if the problem behavior is non-compliance, and the reinforcer is escaping from the tasks, well, maybe maybe escaping from the tasks, it's okay to do once in a while, but maybe you have to teach the child to ask for a break instead, right? So if the reinforcer is escaping from the task, then you have the reinforcer. You know what the kid wants. The kid wants to escape from the task. So, okay, if you ask appropriately, after a certain amount of time engaged with the task, then if you ask appropriately for a break, you can get a break. But if you engage in noncompliance or disruptive behavior, then you're not gonna get a break. And so that means the behavior is under extinction. So when you're using DRA, the first thing you're going to do, of course, you're going to define the target behavior that you want to increase and define the problem or the undesirable competing behavior that you want to decrease. So you have to target the problem and, of course, come up with an alternative solution that you want to reinforce. You need to, of course, identify the reinforcer that is maintaining the problem behavior. And how do you do that? Functional assessment. Then, of course, you have to choose a reinforcer for the desirable behavior. Ideally, the reinforcer is the same reinforcer that maintains the problem behavior. Then you reinforce the desirable behavior as soon as it happens and consistently on a very dense schedule of reinforcement. Oops. You prompt the desirable behavior if necessary. You have to prompt, of course, before the problem behavior occurs, not after, right? So if the problem behavior occurs, then you have to put the problem behavior under extinction, right? And then you have to, deal with that first. But you really want to create a situation in which the problem behavior would typically occur, but then you want to prompt the appropriate behavior. So you may present a demand to the child. Let's say if the behavior is disruptive behavior that occurs to escape tasks. Present the task and then immediately prompt the appropriate behavior. Prompt the child to ask for a break or ask for help if that's the appropriate behavior that you're trying to teach. If you wait until the child engages in problem behavior, then if you then prompt the child to engage in the appropriate behavior at that point, you may be reinforcing a behavioral chain, right? Problem behavior occurs, then you say, oh, you should be doing this instead. And then the child does it, and then you provide the reinforcer. You're teaching essentially the following behavioral chain. I engage in problem behavior, and then I get the opportunity to engage in the appropriate behavior, and then I get a reinforcer. If you do that, you may never get rid of the problem behavior because the kid is going to engage in the problem behavior first, right? It's almost like the kid's going to think like, well, first I need to be disruptive, so then I can be nice, so then I can get the reinforcer. So you need to teach the individual to be nice and get the reinforcer from the beginning. And that's essentially what I just told you about. You have to create the opportunities, the motivation, and the conditions for the behavior to occur. So those are the conditions that typically the problem behavior occurs, but then you beat the problem behavior to the punch by prompting the appropriate behavior instead and providing the reinforcer. Now, if the desirable behavior should require less effort than the problem behavior, that's very important. Lots of research in the area of DRA discussing this. If the problem behavior is easy for the client, to perform, and the appropriate behavior is a very elaborate appropriate behavior and very difficult, now think about it, right? If I have been disruptive all my life and I have been, being reinforced by, my behavior has been reinforced by being disruptive, then that's an easy behavior. It has been reinforced for a really long time. It's easy for me. If I want to escape from a task, I just, punch people, and that works really well. It's very simple to do, just boom, right? Now, if you decide, well, instead of punching, I'd like Kyle to request for help, but I want Kyle to say, raise his hand, and I want him to say, can someone please help me? And if I have difficulty talking, and if my vocal behavior, my language has not been, it's not very sophisticated, then maybe raising my hand and saying this very long sentence is very difficult. It's much easier for me to punch people. Punching is so much simple. So maybe you shouldn't be requiring the individual to engage in this very complicated behavior. Maybe it should be something simple, maybe as simple as me pressing a button or showing you a card or raising my hand, and that's enough for you to come and help me. The appropriate behavior, if you want to replace problem behavior with an appropriate behavior, the appropriate behavior has to be easier, right? Cannot be very effortful. And the reinforcer for the appropriate behavior also has to be better. So if you think about it, you're trying to tip the scales. I have two options. I can either engage in the problem behavior that it's easier for me to do because I have been engaging in this problem behavior forever, or I can engage in the appropriate behavior that you just taught me that is difficult for me to engage in, and it might be too effortful and there's not enough reinforcement. Well, if the new behavior is effortful and there's not enough reinforcement for it, why would I engage in that behavior? I'm going to continue engaging in the problem behavior. So you need to give me an option that is better, right? It's easier. There's more reinforcement. Otherwise, it makes no sense. And I have to eliminate, or we have to eliminate or minimize the reinforcer for the undesirable behavior. So more reinforcement for the appropriate, less reinforcement or no reinforcement for the problem behavior. Appropriate behavior has to be easier. Problem behavior has to be harder, right? So therefore, the choice will be to engage in the appropriate behavior. And of course, later on, you want to thin the schedule, right? Later on, you want to use intermittent reinforcement for the appropriate behavior, but not in the beginning. In the beginning, reinforcement has to be very dense. There has to be a lot of reinforcement there. Now, let me give you an example of a very simple DRA procedure used by my colleague, Dave Wilder. Now, Dave used to be a professor at University of the Pacific in Stockton. He has now been, for several years now, I mean, this is an old article, 2001, but he has been for several years at Florida Institute of Technology in Melbourne, Florida, as a professor there. So this paper was published in 2001, so many years ago, called A Brief Functional Analysis and Treatment of Bizarre Vocalizations in an Adult with Schizophrenia. So this is a brief report, only reporting a treatment of one client. Now, this was a 43-year-old client that was diagnosed with schizophrenia. He was on a bunch of medications throughout the treatment. And I took this directly out of the article so you can see some of the definitions. So the bizarre vocalization, which was considered here defined as the inappropriate behavior, was identified through informal observations and interviews with the home staff, and were defined as phrases or sentences that satisfied one or both of the following criteria. They refer to stimuli or things in the environment that were not present or not being discussed in the conversation, so just stuff out of the blue, or they refer to one of the 5 specific topics. So apparently there were topics that he was obsessive about. So he would talk about karate all the time, again, even if it had nothing to do with the conversation, God, former girlfriends, drugs, and the FBI. Now, appropriate vocalizations were then defined as statements or questions that did not meet the definition of those bizarre vocalizations. And of course, they were contextual, right, based on what was being talked about at the time. And they were measured during, again, the treatment evaluation. They recorded the responses using a 10-second partial interval. Remember partial interval. Anytime during those 10 seconds, if the behavior occurred, they would have marked as an occurrence, and they would then calculate a percentage of occurrence across all the different intervals that were observed. Now, you can go back to the initial chapters if you forgot about partial interval. Now, they conducted a functional analysis of those bizarre vocalizations. So they had a control condition in which it was an enriched environment, remember, a demand condition, which demands were presented, and if the client engaged in bizarre vocalizations, the demands were removed. So as you can see, not a lot of behavior here in the control condition, which you're not supposed to see anyway, because there's no motivation to engage in the problem behavior here. You're getting attention, you have no demands, everything is chilled, everything is cool. Then the demand condition, you also don't see a lot of behavior. They do 2 cycles only of the functional analysis. Then in the alone condition, when the individual is alone, bizarre vocalizations never happen. When do they happen? When bizarre vocalizations are followed by attention. So very clearly, bizarre vocalizations are probably maintained. Well, they thought they was probably maintained by attention. Then they do a functional analysis and they verify that that's the case. Look, problem behavior, bizarre vocalization is maintained by attention, right? Probably in the form of people, talking back to him or telling him, oh, you should not talk about karate all the time, right? Or you should not talk about this topic all the time. Now, what did they do during treatment? Very, very simple treatment. This is a brief report. One client. During treatment, the therapist verbally responded to and made eye contact contingent on the appropriate vocalizations. But when he exhibited bizarre vocalizations, the therapist looked away and made no verbal statements until he had stopped or the client had stopped engaging in the problem behavior or in the bizarre vocalizations for at least 10 seconds. Now, that's super simple, guys. And again, a lot of people would think that those psychotic behaviors would not, be sensitive to reinforcement. Well, let's see what happened. Now we have the baseline here. So this is percentage of intervals with vocalizations on the y-axis and number of sessions in the x-axis. As you can see here, the appropriate behavior is the open circles and the inappropriate behavior is the bizarre vocalizations. You can see there's a little bit more appropriate behavior actually than bizarre vocalizations, but the bizarre vocalizations occur between, like a lot of it is around 30% of the intervals. So it's pretty high. 30% of the intervals, pretty high. Then during the DRA with extinction, right? So differential reinforcement in which appropriate behaviors are being reinforced, bizarre vocalizations are placed under extinction. You see, look at that, like around 90% of the intervals now involve appropriate vocalizations, and bizarre vocalizations, are reduced almost to zero, right? I mean, here and then zero here, right? Almost completely eliminated. I mean, if they had continued this condition, maybe you would have stayed at zero. But then they go back to baseline. During baseline, it's what would happen in the natural environment when he engages in bizarre vocalization. People tell him, stop doing that. And you see behavior goes back, like you see an increase in the bizarre vocalizations. And then when you implement the procedure again, you only reinforce appropriate vocalizations go up almost to 100% of the intervals. And then it goes down almost to zero. So pretty successful, shows pretty clear control, right? If nothing had happened, baseline would have predicted behavior would stay at this level. And then of course you reverse, you reverse the, what's happening, during baseline. You see clear increase in appropriate, decrease in bizarre. Then you go back to baseline and then you replicate the procedure here, showing a replication, showing that it was not until the procedure was implemented that behavior increased, and you see pretty good experimental control here, right? Because of this replication. Now, there's this example is differential reinforcement of alternative behavior in which the reinforcer was a positive reinforcement, right? So behavior produced attention, that's positive reinforcement. So now you deliver attention to the appropriate behavior and you put the inappropriate behavior under extinction. Sometimes the problem behavior is maintained by negative reinforcement, right? So it could be maintained by escape or avoidance. And now you can reinforce the appropriate behavior with escape and avoidance. And people refer to this as differential negative reinforcement of alternative behavior. So in this case, the desirable behavior produces escape or avoidance, which is what the problem behavior used to produce. But of course, the problem behavior doesn't produce escape or avoidance. The problem behavior is placed under extinction. So the problem behavior used to produce escape and avoidance, well, now problem behavior doesn't. It's like problem behavior is broken, doesn't produce any change in the environment, is placed under extinction. So here's another paper, old as well. I picked some old papers. We know a lot about differential reinforcement. So those simple procedures, we only find the simple ones in the literature a long time ago. So this is 1995. This is conducted by Dr. Timothy Vollmer, who was a professor at Louisiana State University and now is a professor at the University of Florida. So a lot of the people left the universities that they used to be, huh? I wonder if I'm going to be here in the next few years. We'll see. So this paper is called The Effects of Differential Negative Reinforcement on Disruption and Compliance. So let's check this out. So the participant here was Sally. She was a 5-year-old girl with Down syndrome, language delay, speech articulation difficulties, and he was in a moderate range of intellectual disabilities. Sally was referred for an assessment and treatment of severe behavior problem. She had a history since infancy of self-injurious behavior, aggression, and disruption. All sessions were conducted in a room in her school, and they conducted 3 to 4 sessions lasting 10 minutes, 5 days a week. Okay, so this was done in the school setting, right? So was referred with a problem behavior, and then they treated her as a client. So how did they measure her behavior? So disruption was defined as Sally throwing instructional materials or removing her butt from the chair used during the instructional sessions, except during the breaks. Of course, during the breaks, she could move her butt out of her chair. Now, how about compliance? So this was disruption, right? Compliance, which is what they wanted her to engage in, that was the appropriate behavior, was defined as following the instruction given by the therapist within 5 seconds after the initial verbal request or demonstration without physical guidance. And then also communication, which was another appropriate behavior that they taught. Communication was defined as saying finished. Remember, in this case, behavior, the disruption, which was the problem behavior in the functional analysis, was found to occur because it produced negative reinforcement. It produced escape. So Sally, when she was presented with a demand during the functional analysis, she would engage in, she would throw the instructional materials, and she removed the butt from the chair and would stand up, right? So that was the disruptive behavior that, according to the functional analysis, was maintained by escape. So what they wanted to do is they wanted to teach compliance and communication to Sally, and the reinforcer for that would be escape. It would also be negative reinforcement. So let's see what they did. So during the baseline condition, here we go, during baseline condition, the therapist presented the instruction. Oops, I don't know why this is happening. This experimenter presented the instructions and praise contingent on the completion of the instruction, right? But escape from tasks was provided on contingent on the occurrence of disruption, because remember, baseline is what normally would happen in the natural environment without treatment. So without treatment, usually when she engaged in problem behavior, she would be able to escape from it, right? So problem behavior disruption will produce escape from the task. Now, during the communication condition, or differential negative reinforcement of communication, which is the B condition, and you'll see in the graph in a second, instructions were terminated, right? So that's the reinforcer escaping from the task. Negative reinforcement was provided on Mans, or when she said finish. So they taught her to say finish. And when she said finish, of course, the tasks went away. Remember, problem behavior, she engaged in disruption, and then the task went away. Here, instead of engaging in disruption, they wanted her to say finish. Then she got a 20-second break. If she engaged in disruption, then she was guided to comply with the task. So the behavior was not reinforced. Now, how about the C condition? So the C condition is when they directly reinforced compliance. And she was now giving a break, which is the reinforcer, remember, contingent on compliance. So she had to comply with the task and then she would get a break. So either she would say finish and get a break or comply and get a break, right? Let's see what happened here. Now, this is, again, you have on this y-axis disruption per minute, and the disruption is the field circle. So you see a lot of disruption here. In the secondary y-axis, you have percentage of instructions with compliance. So this is when Sally engaged in compliance, right? And that is percentage, right? So you have two x's because this is disruptions per minute. This is percentage of compliance, and compliance here is the open circle. Now, as you can see, you see compliance decreasing during baseline and problem behavior disruption going up. So definitely not the trend that you want to see. If no intervention was put in place, that's what you would see. Then they have a differential negative reinforcement in which they taught Sally to say, I'm finished. They did not graph the percentage of time she said, I'm finished. But what they did is they graphed, again, disruptive behavior. So disruptive behavior decreases completely, showing that the effects of this functional communication training. So if you teach the kid to say, I'm finished, she says, I'm finished, but she doesn't engage, and then she doesn't engage in problem behavior, which is great. It means that the procedure works, right? You replace non-compliance with the communication form. However, she's saying I'm finished, and then they give her a break, and then she ends up not completing the tasks. And that's essentially what you see here, the open circles, right? The compliance is really not happening because she's just constantly saying finished. You present the demand, she says, I'm finished. And then she's like, okay, right? That's not a very feasible treatment, I don't think, in this case, right? Then they go back to baseline, they remove treatment, you see disruption. She's presented with a task, and then she's just like, engaging disruption, throwing the materials, not engaging in any compliance. Then what they do is they reinforce the compliance, and then they put the disruption under extinction. It takes a while to pick up. You see some disruptive behavior peaking a little bit in the beginning of treatment, and then a few sessions later. But then eventually compliance takes over and disruption goes down. Notice that this is a raised zero. So the behavior is at zero for 1, 2, 3, 4, 5 consecutive sessions, right? So that's pretty cool. Here they showed, this was a cool clinical evaluation that they show. See here, the differential negative reinforcement of compliance was a better treatment than the differential negative reinforcement of communication. Now, remember the examples that I keep bringing up from the functional assessment unit. And so let's go through them very quickly here and then see if you can think of alternative behaviors that could be taught. Now, imagine you have a 4-year-old tantruming, and we know that that happens when the parents request the child to do something, and again, the behavior produces escape from requests. So what's the function of the behavior? Well, it's a positive or negative reinforcement, negative, and is it socially or automatic? Well, social, right? So this is social negative reinforcement. Well, what kind of reinforcer would you deliver for an appropriate behavior? You have to be social negative. So similar to the example I just gave earlier with the study by Tim Vollmer. In this case, what alternative behavior could you teach? What appropriate behavior could you teach? So instead of tantruming to escape from the requests, what could you teach instead, right? So again, parents are asking the child to do something during the preferred activity. Well, here you could teach the child to ask for maybe, can I have 1 more minute? This kid could still escape from the demands, but there's some things that you can think about, like other, think about other things that you could teach here. Eventually, the child may have to comply with the requests. So maybe the child will not be able to escape all the time. But sometimes if the child has to escape, maybe she can do so by engaging in an appropriate behavior. Here's a tantrum here maintained by a different reinforcer. Now, the child is told that she cannot have something. Now she tantrums and then she gets it. Now, social positive reinforcement in the form of tangible problem behavior produces something the child wants. Can you teach an alternative behavior here? Sure. You can teach, for example, the child to request appropriately, right? And if the child requests appropriately instead of tantruming, the child can get what she wants. Now, you may also have to teach the child that you don't get what you want all the time, but you can also teach an appropriate behavior that would produce the tangible as opposed to the tantrum. And that would be an example of a differential reinforcement of an alternative behavior in the form of a DRA. 10-year-old hair pulling. Now, kid is alone, has negative thoughts and emotions, and then pulls the hair and it produces relief from negative thoughts and emotions. Now, that's a difficult one, right? That's a difficult one because you can't really put the problem behavior under extinction, right? What would be extinction here? It would be the problem behavior no longer produces the reinforcer. Well, the reinforcer is the relief from negative thoughts. You don't have any control over that. So if the individual pulls her hair, she would still produce the relief from the emotion. So that's a behavior that you probably cannot put under extinction. We talked about that in the extinction unit, but can you differentially reinforce an appropriate behavior? Maybe. Maybe here you can teach, I don't know, some meditation or mindfulness training that would help you eliminate the negative thoughts and negative emotions, and that would be much more appropriate than pulling your own hair. Now, 6-year-old hand waving, remember, I'm bored, not engaged, the kid is bored, not engaging in anything, waves her hand, produces visual stimulation. Now, this is another example in which it will be very difficult to put the behavior under extinction. Every time the kid waves her hand in front of her eyes, she's going to produce visual stimulation. Well, what if we teach an appropriate way to produce visual stimulation, right? Maybe you can have a toy that has lights that produces visual stimulation, or things that move very fast, or a kaleidoscope, right? That you can see things, or pictures that the kid can look at. That would produce visual stimulation and it will be appropriate. On the other hand, you cannot put this behavior under extinction, but you can try to reinforce the appropriate version of the behavior or the appropriate behavior with some pretty powerful high magnitude reinforcers. Another behavior, again, 17-year-old, the behavior is hair pulling, right? I think. And alone, oops, cannot see. I couldn't see it. It was on top of it. So let's see, I had something covering the PowerPoint. Here we go. 17-year-old hair pulling, it's alone, tactile stimulation. And again, if I'm pulling the hair to produce tactile stimulation, what would be an appropriate behavior that you can teach? Well, you can teach maybe the individual to manipulate something that would produce the same or similar tactile stimulation that pulling the hair would. Again, it would be difficult to put this behavior under extinction. 17-year-old hair pulling, again, but pulling the hair of others to get attention. That's social positive reinforcement. You can maybe teach an appropriate form of communication to get the attention as opposed to trying to pull other people's hairs. And 8-year-old bites her wrist or his wrist. Then again, that escape from toothbrushing. And again, you could teach the individual to say, my gums are sore. Remember, this is the example that the individual is not only escaping from the task, but escaping from the pain of the sore gums. So maybe here can ask for some medication or something of the sort. May not be able to escape from the toothbrushing, but may be able to escape from the pain. And again, self-scratching alone as a bug bite, and then scratching relieves from the pain. Maybe I can teach the child to apply some cream that would remove some allergy cream, steroid cream maybe that would remove the itch. That would be the alternative behavior for this problem behavior of self-scratching that is maintained by automatic negative reinforcement. So I like you to think of different examples of DRA and DRI, possibly in your day-to-day activity. Also some examples of interventions as well as you read the textbook. That's all I have for today. The next lecture I'm going to be talking about differential reinforcement of other behavior, or DRO. So if you haven't read the chapter yet, it would be great if you could read the DRO section prior to watching the next video. That will definitely make the understanding of the video better. You would understand the video much better. So this was good. Hopefully it was good for me. Hopefully it was good for you. And I'll see you guys in a couple of days on YouTube. Okay, bye.